Dr. Salkar, Goa seems to be right on top, nothing to panic. This show is not about panicking at all. We all need to be very, very relaxed, because panic is the first indication that we are on a on a downhill. So tell us, I mean, Goa, is it because of testing like Kerala? This show is called the South Indian. A lot of my North Indian friends ask me, how come Kerala? I said, that's because we test, you don't. So I mean, so that's the scientific and logical reason. So Dr. Salkar, do tell the viewers about what is the situation in Goa like, and how difficult is the festive season making it for you, Dr. Salkar?
I don't think anybody has to worry for this as of now. The time is an important factor. The
Huh.
more the time goes, the we will know how it actually behaves. See, the number may be anything, but important how fatal it is, how bad it is, how much damage it causes to the lungs or other organs. That will be most important. As of today, we don't have anybody admitted in the hospital for that.
Oh
They are
dear.
all having
Yeah.
some mild symptoms only.
Huh.
So I don't think there should be any problem. But December itself is a heavy season for us.
Huh.
It's a tourist season as well as Christmas is coming nearer. We
Yes.
had a film festival recently. We'll be having a sunburn festival in just coming few days. So we are just giving our advisory that we should be careful. Chief Minister and Health Minister both have taken a high-level meeting, and they have said that as of today there is nothing to worry much. But as I have told you, whatever government guidelines are there, individual has to take its own precautions. If you are above 60 or if you are suffering from cardiac disease, you are suffering from diabetes, kidney problems, cough and cold, and if you have asthma, bronchitis, all these people have to take care of themselves. It is not that just because government says don't
But
use
Dr.
mask, that
Salkar,
means you are just free.
Dr.
Yeah.
Salkar, I have said Christmas, of course, in Goa is beautiful. It's a festival, but I read a lot on a social media platform about the music fest. I think the music
Yeah.
festival. I do not know whether the government is going to take a stand and kind of come down heavily, because festivals, I understand. I don't know. I don't want to make it political, but I think I read you about how a lot of opposition leaders were talking about why this festival. Let me come back to you, Dr. Indu. A very warm welcome to you, Dr. Indu. This subvariant, we are reading different kinds of reports. I read around 15 of them. It says that this is a part of a lineage that includes well known variants like Omicron. Also, what does variant of interest mean? Sometimes these terms jump at us and we are scared. So, just make it easy peasy for the viewers, because at the end of a long article, then there will be 2 lines. Nothing to panic, just take care. But the thing is that you've scared me enough.
Actually, the SARS-CoV-2 virus is
Huh.
evolving. Evolving means it is changing its dress,
Huh.
the shape, so the same person, it's the same person, but comes in a different, just like, several photocopies are taken from a paper, some small changes might happen.
Huh.
So whether these small changes are important enough in terms of public health. It
Or
can
not.
be in the transmissibility, the speed with which it spreads. It can be in severity and seriousness. More number of people get infected, go to ICUs, need oxygen, then the death. So these are the important parameters based on which we categorize a new variant, a new change as variant of interest, variant of concern, etc.
Right.
So this is a variant of interest
Yeah.
because it spreads faster.
Yeah. So,
But when
Dr.
it
Indu, I
comes to,
wanted to
yes,
ask you, but then correct me if I am wrong, but apparently Tirunandapuram and Kannur, these are the 2 districts which are particularly vulnerable. Am I right, or not really? Has the scenario changed now?
it depends on from where the initial cases are detected. Actually, we have a good surveillance system. We continue to test symptomatics. In addition to testing other measures like wearing the mask in hospitals and all, Now
Right.
all the patients wear masks, doctors, nurses, and all our staff wear masks. So those are all general measures
All right.
which will help us to protect ourselves, whether it is the current variant or the upcoming variant.
All
Variant
right.
of interest
Yeah.
may become a variant of concern, but
All
that
right.
those protective measures.
All right.
So some districts definitely, depending on the population density, population mobility,
All right. Okay.
presence of airports, all
Yeah.
those will determine.
All right.
And definitely, yeah.
Let me now go to Dr. Prasanna. Dr. Prasanna, how are you? Long time. Are you well?
Yeah, long time. I'm good. Thank you.
Uh, Dr. Prasanna, you know what Dr. Indu said. I want to ask you, is it true that we don't have to panic, Dr. Prasanna? You and I have done a lot of shows on COVID in the past.
Yes, 100%. I am with Dr. Indu and Dr.
Yes,
Salkar.
but let me
We
ask
need
you,
not
no,
panic
no,
at this
just
time.
Dr. Prasanna, but it
Yeah.
says that the variant has the capability to spread rapidly, and what is scary is that it can evade immunity. Therefore, it has to be monitored constantly, because there is a, India is a large country. So please explain this. You say don't panic, but you say it will spread rapidly. It also can actually, evade immunity. What does this mean?
Yeah, definitely. This is creating a little bit of confusion among
Huh.
the medical fraternity as well.
Huh.
So better is prevention. We request everyone that to follow all the COVID guidelines which were issued in 2020 when we first had the first wave. So it's better to wear the mask when we go outside, out of the house, and all people above 60
Huh.
and who have comorbidities like diabetes, kidney problems, and who are on cancer chemotherapies, they should wear a mask. And even to all our hospital staff, we have given an advisory to wear masks. So prevention is the best thing because it's highly transmissible. That has been proved. But how threatening it is to the life, we are still about to evaluate it over the next few days. But of late, in the last 1 week, what we have seen even in Bangalore is we are seeing admissions related to COVID happening. So we need to step up our vigil and we have to keep the precautionary measures in position.
Yeah, which your health minister Dinesh Gundurao has been saying that there has to be testing, 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 and they are very well prepared. Dr. Salkar, tell me something. It is so confusing. If we can put up the symptoms, please, for this new subvariant, which is about, running nose, a bit of, sore throat, a mild fever, headache, there is coughing, there is, kind of discomfort, etc. How do you know that you have to go get tested? See, when we were living in the era of COVID, sir, Dr. Salkar, even if I don't,
Yeah.
they would say go test, you will have it. But now, after 3 years, how does one go and do it? I don't know. Kerala has fantastic surveillance. But then, as a doctor, what would you advise people? Like if your fever
See,
does
after
not come
for
down?
last 1.5 year, we have been seeing a lot of patients which are having cough, cold, and other things, and they are not responding to any sort of treatment as such,
Huh.
and they continue to have the cough cold for almost a month or so.
Oh my
So we
God.
were expecting some sort of mutation will occur to this COVID virus, and it
Huh.
has come in the over a period. This is going to happen, I think, till some more time. That will be going on changing and mutations and different, variants will come. My only problem is even if this spreads faster, the problem is for those people who are having problems like cardiac and other thing what we have mentioned.
Huh.
But for a normal patient, it may not have normal people. It may not have a significant impact. But important part is, as you said, those who are already on therapies or something, they have to take care of themselves. See, government may issue a lot of advisories. In the end, it is your concern, your body. You have to take care of yourself maximum. So you know you are not well. You don't go to the functions which are attended by so many people. If you are healthy, well and healthy, please take a mask with you anywhere. If you're going, somebody is coughing, just turn yourself away or go away from him. These are very simple things which has to be done. But as I have told you, COVID has baffled us last time. First wave, second wave, Omicron wave, they have baffled all the medical community thoroughly. We have whatever everybody may have said, but nobody was knowing what was actually happening there. Now, whatever treatment we had given, they say that it was not needed. So, a lot of things will happen. As a new thing comes up, it's a time which is important. The more the time goes, when there is no more significant fatalities coming, but we know that this is under control.
All right. Dr. Indu, also this is, it says it features an extra mutation on its spike protein. Now, when you read all this, when you read spike, I can only think of spikes on my head. Also the thing is that it's, okay, so it's like this. You say it's an easy exam, you don't have to really study so much. But the point is that if I study even that one lesson, I can't understand any of it. So this whole thing about extra mutation scares you, on its spike protein. I mean, make it easy for the viewers, because there are lots of people, that now, more often than not, people read up and get into all kinds of panic mode. So therefore, I am asking you.
There are two or three important points from the public health point of view.
Yeah.
First is that there is whether the vaccines which most of us have taken will protect us against JN.1 as well. Till the evidence as on now, WHO also has made it clear, whatever variants have come against severity, against hospital admissions, against mortality, there's a protection. But as is seen in US and data from other countries, there is an increase in MISC, which is multi-system inflammatory disease among children and adults. Actually, that is a little higher for this, and there might be a higher spread among children who are unvaccinated. But our concern is more for those who are elderly, those who have other comorbidities. Most of our population have been vaccinated. The vulnerables have been vaccinated, and vaccine does protect against severity to a very great extent. That's one point which the WHO and the available evidence from all the sources have made it clear. The second point I would like to make is that it's not only COVID that spreads.
Okay.
Not only in India or Kerala or other parts of the world, we have the respiratory syncytial virus, the RSV, the influenza, out of which the H1N1. Of course, flu shots are not common in countries like ours, but in other countries where it's a pattern to take annual flu shots that provides protection. But in our setting, the H1N1 also might be there. So severe infections are persisting longer with more symptoms like breathlessness, hemoptysis or blood-stained sputum. All these are indications of a severe, whatever be the respiratory symptom, people have to seek care, because there is a very effective drug for H1N1, the oseltamivir, which is available in the government sector. So that is also, RSV is another, respiratory syncytial virus.
It's all very scary.
We routinely give a vaccine, but other countries have RSV vaccine as well.